Good morning, guys. Thank you so much for coming super early. Okay, I'll bring you to a little bit of future. Maybe we are already living in the future. My name is Dr. Yudara. I'll share a little bit about HeHealth and what we did with Mpox or monkeypox through our technology and what the future looks like for the next few years. Okay, I'll start with a story which happens to my friend. This is why the HeHealth is born. This is a few years ago, and I work with a lot of young people. Who can read the story? Raise hands. Okay, at least I see a few young people say yes. Everybody feels young who can read this. So, obviously, my friend went out, had some drinks, met a girl, had a lot of dancing, enjoying, had unprotected sex. Next day morning, freaked out. Very straightforward. I'm sure some of us have experienced this. We are a very sex-positive startup. And what happens is when you look at his genitals, penis, he thought there was something abnormal about it. And he quickly Googled, and the idea he got is he have HIV. For scientists, for physicians, it sounds ridiculous, but that is what he thought. And he got so depressed, and he thought HIV is non-curable. He dig into the rabbit hole deeper and deeper and realized, like, I'm dying already. And at some point, within 2 days, he decided to commit suicide. And luckily, he messaged me, and I managed to convince him and get it sorted out. But as a scientist, I asked, how can we help him or create a digital tool to help these kind of situations? That's how the HeHealth was born. I'll come back to it, but let me share some details. As you all know, STDs are a massive problem. It's a global problem. 400 million cases every single year, according to WHO. And it's not a developing country problem. In US, 1 out of 5 people at some point will get STD, STI. And 40% of them, they are symptomatic STDs. That means you can easily figure it out. In the overview, we look at why such a big problem is not able to tackle. Most of my colleagues, yesterday we talked about these things, so I will quickly go through. So the biggest problem is the stigma is complicating the access. People don't want to go to a clinic, don't want to be seen sitting in STD clinic. And finding STD doctors is difficult. That's what Russell talked about. And WHO says the clinical diagnosis of a STI by a doctor is only up to about 50%. That's good as flipping a coin and ask whether I have STD or not. And of course, getting the STD testing is very expensive, which cost about a few $100s. In STD, just to get a chlamydia test can go up to $400. Who can afford this? Especially young people. What it means is, WHO say to get a diagnosis, up to 50% of the people, it takes 14 to 90 days after the symptoms start. I thought with the COVID, early diagnosis is key. We cannot afford to go like this. We created HeHealth to solve these things. This is the future we are looking at. Something digital. Future of STD, we believe, lies in your mobile, as same as everything else. And it will be accessible, results in less than 1 minute. You can do it at your home with the privacy and comfort. And results will be accurate up to 90%. And then the most expensive thing, it'll be less expensive. The cost for us is less than 10 cents. From few $100s to few cents. That's the future. What it means is, anyone in the world who have symptoms, they will be able to get a diagnosis or screening as soon as they get the symptoms. Not 14 days, not 90 days. How we want HeHealth to work is as simple as you open an app, answer a few questions, upload a picture of your relevant concern areas, and of course we'll connect to we give the immediate screening results and connect to our service providers to get them checked, and then of course start treatment. And we work on 4 diseases at the moment. Of course, there are about 10 diseases we can risk, but our focus is HPV, HSV, and syphilis, and of course, monkeypox. We launched our public beta testing app last year, and we have more than 30,000 people download. There are more than 100 articles around the world. Some languages I even didn't read. I don't know how it spreads or go viral. And with that, of course, we are working with some of the government agencies in Singapore, US, India, and some of the private organizations also. And this is ambitious project, which is we are at the stepping stones. But I'll share a little bit of how we actually applied it within the first year of our operations into a real world problem. When the monkeypox or Mpox pops up last year, and we thought, okay, our digital diagnostic tool can be repurposed into detecting monkeypox. So We did it in a very non-traditional way. Instead of you waiting for the data to be collected for a few months and then come up with the answer, we launch our solutions in 2 months. I'll talk about it in details. Some of these things are heavily using artificial intelligence. Now everybody talks about AI, and generative AI. We've been using generative AI for data generations, data validations, patient validations, and results validations for a few years. I'm presenting part of my research in poster presentation during the lunch. Come and find me, I'll tell more, but I'll quickly walk you through. So when the monkeypox came, we took a different approach. Instead of we going to the hospital, we reached the community which we are already dealing very closely. We asked them to share the data directly with the consent. So we use this data to build our system. Within 2 months, we were able to actually get more than 1,000 pictures from the users. And we, of course, work with CDC and WHO to get the publicly available data sets and some of the not even publicly available data sets about the patients they collected. And we combine these two and create a digital tool which we collect the geolocation, patient's information like age, the sexual preference, and recent contacts. And of course, the visual features. That means you have to submit a picture of where you have rashes. Our specialty is we use, in Gen Z words, dick pics, where the symptoms are in genitals. We can actually screen it better, which most of the other platforms blocks it. There's no way you can access these informations in Google or any other service other than us in the world. So with that, we actually managed to hit a very impressive numbers. In 2 months, while we are doing iterations at the early stage, in vitro testing, we managed to hit about 88% rule in and 90% rule out. We are right now doing the actual on-ground result verifications with FDA and a group called KOID with the US physicians involved and see how much it actually works on the ground. What it means is, of course, in the real life, people may be taking picture in the dark, or people's skin tone might be affecting our accuracies. So these are, but some of the early results still shows that we are somewhere around 80% plus minus. Imagine from few $100 PCR blood test to few cents of a screening test. That's the future looks like. And what it means is to users and what it means to public health. Actually, for patients, it's a stigmatized problem. It's MSM disease, which people are not willing to go to clinics. And if you see in last time in US, last year, people have to queue up. Who wants to queue up for a test which you won't even disclose your thing, sexual preference? That's the problem we are solving. And it'll be immediate and easy access. The results is instant and it's personalized. And of course, we have no bias because this is completely automated machine talking to you and giving the idea. So machine doesn't judge unless the person who's training it is judged. So the public health, it's easy to deploy and scale. Everybody carries a phone. Last time you had to set clinics, train people, now nothing. You can just ask the people to use it. That's the future we are looking at. And that's the HeHealth and our application to current problems, but my topic is a little bit broader. I want to touch on how the technology actually changes sexual health in the world. World is changing faster, and I wish I have more time to tell, but I'll little bit touch on OpenAI. Who is using ChatGPT? Okay, I love you guys. I use every day at least about 3-4 hours, and to a point that my wife complains that I talk to GPT more than her. But at least I didn't give a female name, so I give a male name. So anyway, it truly revolutionized. Look at this question. So this is a hypothetical situation. This is HIV patient on antiretroviral treatment, and he had a new girlfriend, had sex with him, and then he did not say. This question carries so many different aspects. It's about medical part, pharmacological part, and the medico-legal part, and of course all the other relevant parts. Last time, only a trained person or multiple people who have information about it can answer. Look at what the GPT-4, this is the upgraded paid version of ChatGPT. It can nicely say in a very human way, addressing all the aspects of the problem. Look at it. If you're living with HIV, it's important that you disclose the status to potential sexual partners. This is not only respects their rights and make informed decision about their own health, but also important of their own health and well-being. In many places, it's legal requirement. It talks about legalities. It talks about the human nature of why we need to tell. Not only about that, it talks about ethics. Are we supposed to tell? Are we not supposed to tell? Look at this answer. This is amazing answer which a trained multiple people have to come together to form it. But now the technology can give. This is not only stopping there. And if person thinks that he wants a little bit of more research to be done, you can literally do a literature review, and it'll literally in 1 minute can summarize all the literature review under this topic, and which we researchers used to take few days or few weeks. And this is in 1 second, literally. So please use it. It can help you, but of course there are a lot of bias at the moment. You have to fact verify, and there are technology coming to even verify these things. If you use the new upgraded version with the Bing plugin, it can actually verify these resources immediately, real time. But what I'm saying is, I'm painting a picture, the future, how it can be changing things. Few last words. We talk about stigma. We talk about how the future looks like, and we want to talk about inclusiveness. This is the future we are talking about. If you keep talking about stigma, but if the people are involved, it's very difficult to break this stigma because people are always judgment. But if you can use the technology, if you can use the machines, if you can use the AI, if you train it well, they are not judging you at all. That's the future, at least I'm looking at. We want to create a comprehensive system where the sexual education, sexual research, and sexual health well-being be managed by digitalized, automated processes, maybe even without human intervention at all, completely digital virtual platforms, so that you feel safe, you feel happy about these things. So we say from worry to happy, everything digital. That's the future I'm at least trying to create. This is a stepping stone for us. I'll be... You can reach me in LinkedIn. I'll be in the lunch presenting a poster for monkeypox. Find me, happy to answer a lot of questions I'm sure you have. Yes, join us for this amazing future we are trying to create. Thank you so much.